Good evening, everyone, and thank you so much for joining us on this sunny evening. We are just about to kick off our webinar for nursing and healthcare at ATU, and I'll just give it another minute. I think there's a few more people just trying to log on as we start off. Um, Let me just double check. Hopefully you can all see my screen there. We have a number of slides to share with you today. We'll just kick off then, and I'd like to welcome everybody along. The webinar this evening is going to last approximately 45 minutes. We are recording the webinar as well, so just to let you know that if you have to drop off at any stage, or people that wanted to attend that weren't able to, we will be circulating a watch back link to everybody who did register their interest in attending today. So there'll be plenty of content there. Everybody who's joined the webinar, your camera and your microphone is off. We have a panel of speakers, but we do have also a Q&A there in the window as well. So you'll see the little button there, and if you want to put in a question, if anything as we're going through, if you have questions on it, we have a team of advisors in the background who are able to take those questions and come back to you. So if anything at all crops up during it, feel free to drop in a question there. So I'll start by just introducing the panel. We have a great range of people who are going to talk to you today. We have with us, joining us on the call is Breda Mulgrew from our Donegal campus. Breda, if you want to give a wee wave there, lovely. And then from our St. Angela's campus, we have Dympna O'Connell, and we have Patsy Mc Sharry as well, who are going to talk about the range of programmes available there and spotlight some. And then from our Mayo campus, we have Dr. Carmel Heaney, and we have also got Daniel Caldwell. And delighted to have such a broad range of experts in the room this evening to go through all the courses that we have available. And then in addition to that, we also have Margaret Kelly, who is a graduate of our Master of Science in Palliative and End of Life Care. So Margaret is joining us. She's thank you, Margaret, for waving there. She's actually working at the moment, and so she's stealing a few quiet minutes here to hopefully join us today and share her story about her experience studying and working and all the rest. So we look forward to hearing that. So just the agenda there again, we'll roughly run through these different areas. We'll also at the end talk a little bit about how to apply and funding opportunities that are available and different ways to get to apply to courses. So just for those of you who are joining who maybe aren't familiar with Atlantic Technological University, so Atlantic Technological University, where also we will pronounce it as ATU, we're a multi-campus university, as you will have noticed from our introductions alone. We have 9 campuses spread across the west and the northwest of Ireland. We have over 26,000 students studying with us, and that ranges from full-time undergraduate to part-time undergraduate to postgraduate and right up to master's and doctorate level. So we have a really vibrant student population. Every year we get about 8,000 graduates, and they all graduate with a university qualification. We've over 2,500 staff as well, and we have in the part-time and online space that we're talking about today in the postgraduate space, we have about 8 discipline areas that we look into. So today we're focusing on one of those as in nursing and healthcare. And then also just, the focus of this evening is on flexible learning. So a lot of the programs that we're talking about, they are really aimed and built and targeted at people who are in the workplace, looking to upskill, looking to retrain, looking to enhance their qualifications to maybe move on in their career. So the structure of the programs is very much, they are part-time by nature, blended, online or on campus, but at a time that suits maybe those people who are actually working as well. So everything we talk about here, it really is trying to encourage, I suppose, people who maybe are looking to seek further qualifications while also balancing other life commitments. There is obviously full employment at the moment in the Irish market anyway, in the Irish context, and lots of job opportunities. So again, we do see that people who generally come back and study and further their qualifications, they do get a competitive advantage in the employer market as well. So it is a case that, we do see again, I meet a lot of students at graduation, and it really does have a big impact on their career when they come back and study. Also, the whole idea of lifelong learning is something that, again, we encourage hugely here at ATU, and we know that the market is changing, the new technologies that are out there, the enhanced learning that is available. It does really give people the edge as well when they're trying to, I suppose, keep up with the world of work. So everything we talk about today as well, all the courses that each of our lecturers are going to be talking about, they are at different levels. So we offer from, as I mentioned earlier, from level 6 to level 10. Now, level 6 is a higher certificate, level 7 is a degree program, level 8 is an honours degree or a higher diploma, level 9 then is postgraduate, and you can have postgraduate diplomas, postgraduate certificates, postgraduate master's programs. And what we find is, again, people dip in and out and come in at different stages in their careers and maybe take qualifications at different levels. We'll talk a little bit about recognition of prior learning as well as an entry point where people can actually, they maybe have worked for several years and they have built up on the job learning or experience, and that could be recognised as to help them enter into certain courses at a certain level. So we'll come back to that as well. And then, as I mentioned, just the focus today is on science and health. So across our science and health discipline area, ATU offers 168 programmes, and they would be ranging in level 9, 8, 7 and 6, and then also across those different delivery modes that I mentioned. Some are online, so they do not require attendance on campus predominantly. Sometimes there's optional attendance. 62 are blended, where we may need somebody to come in and do residential, and again, each of our lecturers will touch on what's relevant in their programs that they're spotlighting. And then some are on campus but maybe part-time on campus as well, so still able to work and study. What we're focusing on today is the nursing and healthcare section. So 47 courses available across ATU in nursing and healthcare. So without further ado, I'm going to hand over to Breda. That's just giving you a broad introduction, and Breda is going to talk to you in more detail about the Donegal courses that are available in nursing and healthcare. So do please add in questions in the chat if you have any as Breda is talking, and the team will answer them.
Okay, good evening everybody on this lovely sunny evening. Okay, so here in nursing and healthcare in Donegal, we have an array of subjects or courses are available for you as postgraduates. So for nursing itself, gerontology nursing, professional nursing, gerontology practice, or acute medicine nursing and emergency nursing. These are all nursing programs, and they're at a level 9 level, whereby you have to be a registered nurse to apply for any of these. In health, we have a contemporary healthcare management, which is a level 9 certificate program, but also advancing health and social care and therapeutic interventions for alcohol and other drugs. Both these you can exit at a postgraduate level, a PGD, or else continue on to have an MSc in with either of these. Now, advancing health and social care tends to be much more in demand, and supposedly because it's much more multidisciplinary. The therapeutic interventions for alcohol and other drugs tend to be much more specialised, and while some of these modules will be core modules and they're shared, there's other specialist modules in relation to those. If we talk about acute medicine nursing, emergency nursing, all these modules will actually be delivered on a blended approach, whereby there'll be some contact time face-to-face in the classroom here on site, and also within also some online. If we focus now on the gerontology program itself, let me just go to the next slide here. So in this program, Spotlight for the gerontology nursing or gerontology practice, the difference between both these programs, first of all, is gerontology nursing. To apply to do this, both these are level 9 postgraduate courses, and gerontology nursing, you have to be a registered nurse on any of the disciplines of nursing to apply for gerontology nursing. On the other hand, you can apply for gerontology practice, and this is more eligible for those people who are doing anything to do with social care professions, who are registered with CARU or the equivalent, or anybody who's achieved done a level 8 degree, and they have in either the health science or health studies or social science or social studies. They can also apply for these modules. The postgraduate diploma is the first part of this program, and what it does is that for the first 3 semesters you complete these modules, which you can see they're outlined down here. These modules, which include both core modules and also some specialist modules in relation to this. If the person can exit that with a postgraduate diploma, which would be after 3 semesters, with a postgraduate diploma in either gerontology nursing or gerontology practice, or else they can continue on for another 3 months, or sorry, for another semester, and they will complete, it'll be another 30 ECTs, and they'll complete a research dissertation practicum, which means that they can exit with a Master of Science in gerontology nursing or in gerontology practice. In relation to that, those modules themselves, to apply for those modules, as I said, for the gerontology nursing, you need to be either a registered nurse on any of the disciplines, either mental health or intellectual disability. And then for those that are applying for the gerontology in practice, these modules themselves, you will have to, or for this course, you will have to be either registered with any of the allied health groups or the social care professions, be on the register with CRU. For each of these module or courses, you need to be a year post-reg with 6 months practice in the care of the older person and be currently employed in that area. For the module itself as well, while you've completed those modules, you have to complete practice placement module, and that is done while you're actually engaging in practice throughout the duration of the course itself. That essentially is signed off by your supervisor. You complete X amount of hours, and then finally signed off with the coordinator of the course. That's just a matter of submitting the like of continuing with a learning contract, and also then submitting a piece of reflection in relation to that. So these modules themselves are all pretty accessible, and also if you don't have a level 8 program, you can also apply for via advanced entry, and that means you apply directly to the college with relevant documentation and academic results, and based on your practice and you can get accreditation for prior learning and gain access to the course in that way. Now, for some people who may not have completed a level 8 honours degree, they may have completed level 7, and they've also had many years of experience within care of the older person. This part of that entry plan would actually be very much useful for these people. Also within this course, there is funding available, and particularly with Nursing Homes Ireland. Nursing Homes Ireland allows you to, you can apply for funding through SkillNet, and SkillNet is part of the Department of Health, and they provide funding for this. To apply, you do this through the website, through the website, and you apply through, depending on whatever course or whatever campus site you're applying for. Can we just go to the next slide? Thank you. For applying for this course itself is delivered across the 3 campuses. So we have St Angela's, ATU St Angela's, Donegal, and Mayo or Castlebar. So within this, the students can apply to that. So you'd register if you wanted to. You can register through St Angela's, Donegal, or Mayo. Either way, what you will do is that those courses are delivered across the 3 campuses. So you may be playing like one campus. You may be in Letterkenny for one of these days, in Mayo for another day, and you have one day online. But the way we've developed these modules is that there'll be 2 days face-to-face and 1 day online, and then they're shared between Mayo, Castlebar, and St Andrews and ourselves. In relation to this, as we see here, it's designed very much for registered nurses and health and social care professionals, particularly in CRU, working with older adults. And what it really does is enhances your theoretical knowledge and professional values. For those people who wish to develop further knowledge and information in relation to the particular area, and also want to develop a career pathway for themselves, this is very much the course for them. This course is accredited by the Nursing and Midwifery Board of Ireland, and it offers qualifications to gerontology nursing or gerontology practice with both, as we said, flexible campus options. Thank you.
Brilliant, Breda. Thank you so much for giving a real detailed overview on that. And then there is obviously the contact details there if anybody has any questions and if they're interested in a specific campus. So we have those details. And again, as I mentioned, we'll have the watch back going out, so you can definitely take them from there. And any courses we talk about today, you can also find out more on the ATU website. So atu.ie/flexible will take you through to all the course information about any of the programs we mentioned today. So thank you, Breda. That was a great overview and real in-depth knowledge, and that's a new course as well from ATU Gerontology Nursing. It has its first intake at the moment, so it'll be, it's right up to date in terms of what it offers. So we'll move on now to Dympna. So Dympna is going to give an overview of what's available across St Angela's campus.
Thanks, Cleo. So at St. Angela's campus, then you see there on the slide before you some of the programs that we offer in nursing, and then also kind of health and professional programs. Um, so I'll just start out by talking maybe about three of our programs, and Patsy, my colleague, is going to talk about a further two then briefly as well. So I'll just start out by talking about nursing studies that you see on the list there in front of you. We run a master's and PG dip and master's in nursing studies or stroke professional studies. So students who are our nurses obviously will be looking for the nursing award from this program, and allied healthcare professionals looking for the professional award from this program. This is quite a flexible program. I suppose it's aimed at people working in the acute or community setting, but maybe is not yet ready to specialize in a particular area such as ICU or CCU or renal, etc. So for these particular students then they would take a selection. Sorry, just I need to interrupt for just a second.
I don't know, Patsy, do you want to maybe we'll click?
Sorry,
Oh, you're back.
Sorry for the interruption.
No
So they
bother
will
at all.
take a selection of what we called standalone modules on this particular program. So they take 6 modules in total. 2 of those modules are core. It includes the research modules. And then the other 4 modules that they would choose will be from a suite of modules that might suit them to their particular practice area. And the suite of modules you see on your right-hand side doesn't necessarily list them all, but does list many of the modules we offer. So students can kind of, depending on the area they're working in, choose 4 other modules that suit them. So this is quite a unique program in that a little bit of a build your own program, which suits, and it runs over the PG dip level of it, taking the those 6 modules runs over 2 to 3 years, and that's a little bit more flexible in that it allows students to maybe take a module per semester instead of packing in more modules in a shorter amount of time, which kind of suits maybe mature learners and people who are working full time, etc. So the second program I'll highlight then is the International Healthcare Masters and International Healthcare Management Masters, and that's a particular program that it's unique in its own way in that it is an international program and with a national stream. So both international students and national students apply for this program and they take it. It actually is an on-campus program. So students, when they're coming from international students, will travel and stay here in Ireland on a 2-year work visa. And then they get that nice opportunity, I suppose, to mix with national students as well. So they get a good variety of I suppose, exposure and whatever networking in that particular program. It has, a particular suite of modules that relate to management, such as healthcare leadership, project management, quality and healthcare management, enhancing evidence-based practice. So there's a variety of modules within the program. That can be taken 1 year full-time or it can be taken 2 years part-time, whatever the student chooses to do. So that is a master's program then as well. So there's no exit point of PG dip off that program, but they just go and do the full masters. Then the last program I'll point out then is the PG Cert diploma and masters in applied health and wellness coaching, and that's quite a unique program in that it is preparing students to qualify as and practice in health coaching, and health coaching, I suppose, focuses mainly on promoting people and assisting and helping people, I suppose, manage their health goals in their lives, and particularly around the management of chronic illness would be a big focus of that particular program. It has, the first year is a CERT program, and actually the modules on the first year, once you take those modules, you are eligible then to apply for accreditation as a health coach. So it has accreditation with the international body for health coaching, and students can apply and work as a health coach after year 1, but they have the option then to go on to year 2 and increase their qualification to diploma level and then on to master's level if they choose to do that in a 3rd year. I suppose with all of those programs, what we try to do is have a structure where they all have modules that run as standalones. So again, you'll see them on the other side there. But students then on any of those programs may, if they wish, take a standalone module and then decide maybe if that standalone module may be on a number of programs, they could decide then what program they want to transfer into, or it gives them the opportunity maybe to get 1 or 2 modules done on a program before actually commencing the full program. So I suppose it allows people to get a flavour or dip their toe in, or maybe get some work done before actually starting onto the commitment of a full program. All of these programs, mainly have a blended approach where some classes will be given online, some classes will be given on site, and modules tend to have overall in our postgraduate suite have 2 to 3 attendance days at the most. Allowing then, maybe that little bit of flexibility with work and with study. Yeah.
The life commitments,
yeah. So we'll let Patsy maybe take over on the other 2 because I don't want to
great.
take up too much of her time as well. So
that was great, Dympna. Look, thanks. And obviously there's a huge suite there that you've gone through. I think, again, a lot of it, by the sounds of things, students need a bit of advice or, a bit of guidance. So obviously yourself, you're available if anybody who's listening maybe has kind of questions about that around the stepping stones to maybe get to a qualification. So we'll just hand over to Patsy then. Thank you, Dympna, because I know you're going to spotlight another programme.
Yes. Yes. Good evening, everybody. And delighted to be here to tell you a little bit about the mental health programs that we have on offer in the Nursing and Health Studies Department. So, Cleo, if you wouldn't mind just going back to the previous one, just so that I can, before I move on to CBT, just to highlight community mental health, which was on the previous slide. So, and Dympna give a great overview of all of the courses, and as you can see, there's a huge big there's a huge big lot of courses here on offer in ATU St Angela's. So community mental health nursing, I coordinate this programme, and I took over from my colleague Tom Grady, who some of you may have known, who developed this programme way back, and it's an extremely successful postgraduate diploma / master's programme in community mental health nursing. So it continues to be very popular because it's very much, it's category 2 in MBI, and it's also linked with the HSE CNS requirement for qualification. So many of our graduates have gone on to become clinical nurse specialists, and obviously that's so it's a big career move, and it's a big incentive for applicants there, and the course itself has 5 core modules, the postgraduate diploma part, 5 core modules, and then the 6th module, you need 6 for the postgraduate diploma, the 6th module is an elective, and they get to choose from elective modules in either Introduction to CBT, one on eating disorders, one on early intervention for people experiencing first steps of psychosis. So that's they get to choose from those modules for their elective. So again, a bit like as Dympna explained in the other programme, they get to titrate the course to their area of specialism. So as I say, very, very, very popular programme, and it happens on campus, and it's over 1 year for postgraduate diploma, and then another year for the dissertation, master's level. So I'll go on to the cognitive behaviour. I'm spotlighting this particular programme because it's relatively new. So this is a master's / postgraduate diploma in cognitive behavioural psychotherapy. Again, a really exciting programme that I've been privileged to be part of its development over the last year, and we welcomed our first cohort of students on campus in January. So and we're having another intake this September. So we're really excited about that. The course is the 6 modules in the first year. And as you can see there, it's very specific cognitive behavioural psychotherapy. Effectively, you are prepared to be either a clinical nurse specialist in cognitive behavioural psychotherapy, or a cognitive behavioural therapist from another discipline, as long as you work in mental health. So the eligibility criteria for this programme is for mental health nurses, and our other nurses can be APEL'd onto it, or other healthcare professionals like social workers, occupational therapists, psychologists, whatever. So all of the allied healthcare professionals working in mental health. This is, again, it's category 2 NMBI, and also the content has been worked out very carefully to be in line with the British Association for Cognitive Behavioural Psychotherapy. And we're working closely with that body so that in time the student graduate would be eligible to apply for accreditation with that body. So the first year is over 1 calendar year, runs from September to the following September, and attendance is on campus. And as you can see, these are very specific modules around CBT, effectively using CBT for depression and anxiety, which is the most common uses, but then going on to develop it into complex presentations as well. So all of that is very carefully worked out and titrated with a professional practice placement. So the student coming on this programme needs to have a placement within a mental health setting and have a supervisor, somebody who can supervise them, who's a qualified cognitive behavioural therapist. So let me see, anything else about that? The second year is a academic year for the dissertation. So year 2 is the dissertation, but students can exit after the calendar year with a postgraduate diploma, as is the case with the community mental health as well. And many of our students choose to do that, particularly from the community mental health, in that it's still a level 9, and as I say, meets the HSE criteria for CNS. So many of them do that, and maybe sometimes come back and do the masters a little while later. And similarly with this program here, there's more attendance on campus for this program. But I'm available to answer any specific questions around it. No problem.
Brilliant. Thank you very much, Patsy and Dympna. That's been a comprehensive overview of all the different offerings. And what's nice is everybody has a very kind of specialist area that they're working across. So hopefully there's a huge variety of opportunity for people. I'm going to hand over now to Dr. Carmel Heaney to go through the overview of nursing and healthcare at the Mayo campus. Is that okay, Carmel?
Lovely, thanks a million. Good evening, everybody. I'm delighted to be here and meet you online this evening. I'm based on the Mayo campuses, and I'm going to talk to you about some of the nursing and interdisciplinary healthcare programs we offer. The good news is, even though we're based in Mayo, all of these programs are either blended or fully online. So the first one I'll talk about are the group of Master of Science programs. So we have 3 offerings there at the moment. We've quality and safety in healthcare, palliative care and end of life, and I won't go into that because Daniel will pick up on that in the next session, and applied leadership and management in healthcare. So the quality and safety program is a master's, which is done over 2 years, or a postgraduate diploma, which is 60 credits over 1 year. And the applied leadership and management has a certificate option, which is 30 credits over 1 semester, 3 modules, a postgraduate diploma, which is across 1 academic year or 26 weeks, where you do 6 modules, and the MSc is a second year of study in which you undertake a dissertation. The dissertation for the master's programs is designed as part of the research module in year 1. So that's important to consider. Your assessment is the design of a research proposal. So when you go forward to year 2, you really hit the ground running. Year 1 of the master's programs is residential delivery. So we have a Thursday afternoon and all day Friday, 4 times in each semester. and we encourage the students, if they wish to stay overnight in the hotel adjacent to our campus, the fee for that is enmeshed in the fee for the programme, so it's not an additional cost. And our students report back really well on it, giving, I suppose, a genuine immersion or time out from work and from home, if you can do that, to focus on your studies, but also to network. And all the programmes are delivered on the same days, so you're not just networking within the one programme, the students from all the programmes are there in that residential together, so it does create a nice peer support environment. So that's year one. The quality and safety programme is really orientated to anyone working in practice or governance roles. Quality and safety applies to any practitioner, no matter what environment or rank they're working in. So it's not just focused at managerial. And then the leadership and management programme is really for people who have a desire or ambition to go into leadership roles, or might be already in one and feel like they want to get a qualification to further support their competence and confidence in that area. Then we have shorter programs. Sorry, I'll just mention year two of the Masters, you don't need to be on site. You're allocated a supervisor, and we typically use our Teams platform that we're using here tonight, and you agree engaging with your supervisor at intervals. So it doesn't matter where you live in the country, it's a very engaging model. You're meeting your supervisor frequently, but we'll do it at times that work for you and the supervisor, and it's quite a fluid process. The shorter programs then we have are, we've some around the digital health domain. So healthcare analytics is a level 9 program, so you have to have a level 8 degree, or there's RPL that will be spoken about later as an option. That's fully online, and it's usually a lunchtime session one day a week and an evening session one day a week, 2 hours of each. And building digital healthcare communities, again, fully online, that's level 8. So it would suit nurses that don't have a level 8 degree yet, maybe have a level 7 qualification, or people working in administration grades that mightn't have a level 8 or be looking for a level 9 qualification. That's 30 credits across 26 weeks, which is one academic year. The healthcare analytics is also across 26 weeks. The eHealth cert is a 10 credit cert across 12 weeks, fully online. And then the acute medicine program is a 10 credit, so it's a single module. It's an NIMBY registered program, and it is delivered online and 1 day in campus. And procedural sedation is delivered online and 2 days in campus, and is also an NIMBY registered program. So that's just really a quick overview of our offerings. You can email me at any time to get more information, and thank you for your attention. I'll pass over to Daniel now, who'll talk about the palliative and end of life program.
Brilliant. Thank you so much, Carmel. Daniel, I'm just conscious of time, and I know we really do have to.
We'll just keep moving. I will
yeah.
just say that, great to see you all online. Just to say that the structure that Carmel outlined is a similar structure for this programme, so I'm not going to reiterate all of the points that have already been made. RPL is an option. The placement combines a community placement and a specialist placement in palliative care services in the country. The requirement of entry is that you have 1 year post-registration, and the programme itself is interdisciplinary, so we do have a wide variety of people from different allied healthcare professions and nurses taking the programme. We've just completed our review by NIMBY at the end of last year, so that is still there, and the opportunity to progress to CNS is built within the programme and accredited in that way. Just to say as well, the staff and that teach into the programme are very engaged in practice context, because we feel it's really important that we keep that practice aspect in relation to the programme, and also research and communities of practice nationally. All three of the staff are actually chairs of National All Ireland Institute communities of practice. So that's kind of their commitment in that space. I'm delighted to be joined by one of our graduates. So I'm just going to move on to that point. And if you have any questions, feel free to contact me at any time. Margaret is a graduate of the programme and obviously is currently a staff nurse in the Northwest Hospice. And so rather than me talking on and on about it, I thought it might be good for me to maybe ask a few questions of Margaret, and she can then give you her experience in relation to the programme. So it's great to have you with us, Margaret. I realise you're at work, so I'll try and be as brief as possible. And thanks for joining us on the call this evening. I just want to begin by maybe asking you what motivated you to undertake a postgraduate course.
Hi everybody, good evening. What motivated me, Daniel, was my grandmother pre-COVID died in the acute setting. And while the staff did do their very best to deliver person-centred care, just the system and the operational organisational system of the acute setting just did not allow for it. So this kind of put an innate desire in me to progress and specialise in palliative and end-of-life care, and then to be able to help families and the person as they navigate through the emotional turmoil of going through a life-changing journey.
Brilliant. And obviously you're travelling from Sligo up and down to Mayo for those 4 in-persons, but overall, what was your experience of the course when you got your MSc?
So I pursued formal education later in life. So I actually got my degree originally with GMIT in Mayo. So I was 3 years qualified when my grandmother died. And then I specialised in the palliative care with yourselves in ATU and Mayo. The course is student-centred. So it is, and there is no hierarchy or anything like that. Like staff and students are on first name basis, and you can contact them. They're available. They meet you where you are on your life continuum. Everyone is coming at different stages of life. There's people with kids, people with careers. There's younger people, and I think it's very open and welcoming, so it is to everyone in all the different stages of their life as they navigate formal education while multitasking a full-time job as well.
And obviously you're now a enhanced staff nurse in a palliative care setting in Northwest Hospice. So how did the educational journey impact your career?
So I suppose when I started off on the postgrad course, I was a staff nurse in the acute setting. And from that, then a position became available in Northwest Hospice, which I have been doing for the last just slightly over 2.5 years. And I'm actually starting a new position as CNS in May. So my career has progressed like full circle really from undertaking the postgrad and the masters in palliative and end-of-life care. I fine-tuned my communication skills. I had a good baseline of theory leaving ATU with symptom management and communication. And I think the biggest thing is to navigate all the different cultural diversity in our population and also our ageing population. So I left ATU with a full kind of pocketbook of theory behind me. And then in Northwest Hospice, I gained great clinical experience that I'm now going to take into my new role.
Super. And my final question, and thanks so much for being with us this evening, because I know Chloe will want to take kind of the call in another direction. But do you have any advice for anyone thinking of studying this course at ATU or any of the other postgrads that have been mentioned this evening?
I can only talk about studying the palliative and end-of-life care course. And palliative care is an incredibly rewarding career, so it is, but it is very emotionally taxing as well. So you need to have a strong emotional resilience, be able to engage in reflection and self-care, but also be able to take guidance from your peers, and whether that's in line of managers or academic or whatever way you can get that emotional guidance from. Communication is also central to the palliative care in practice and in theory, and you need to be able to listen and show empathy, and these are all cornerstones that ye as lecturers in ATU sent us all off with an abundance. The lecturers are so passionate about this course, and it comes across in the way that they teach and the way that they get you ready for the clinic environment. So they do. It's one of the best career moves I ever made, and I'll be forever grateful for the foundations I got in ATU, and I wouldn't hesitate to recommend the course in ATU Mayo. So
super. Thank you so much, Margaret, for being with us. You've presented at conferences, you've a paper accepted into another conference, I understand. So you're continuing your educational journey, and thank you for being with us tonight. Chloe, I'm going to hand back to you. Sorry if I went over time.
Lovely. Not at all, Daniel. Thank you so much, Margaret. I know you had to jump off now because you are at work, so we really do appreciate you giving us your time and all the words that you've shared there of wisdom and your experience. So thank you so much for joining us this evening.
Thank you. Thank you. Bye-bye.
Bye-bye. Now, listen, we've heard from all our academic colleagues now, and really inspirational piece there at the end as well to I suppose tie it all together. It really does show, you know, everybody has talked about the different options and everybody's on their own career journey, and whatever area you might want to specialise in, I think there's an option there at ATU, and any of our lecturers that have spoken this evening are, you know, willing to help help you find your path on that journey as well, I think. So it'd be vital to share this information with your colleagues, or again, watch back the link and share the watch back link. I'm just going to summarise a few little points at the end that are not major. I suppose it's just like, what do you do now? If we have inspired you, how do you take the next step? So any of the courses we mentioned today, there is a course web page available on atu.ie. Just search up the title, you should be able to find it there. Check the course web page, check the entry requirements. I suppose that's one of the things we're all talking, and we're talking about different levels. Make sure that the level you have suits the level that your previous qualifications, you know, will get you onto the course. If they don't get you onto the course, I suppose one of the things we've talked about a little bit is recognition of prior learning. So you've maybe have studied for a while, you've worked for a while, you mightn't have the level you need. Just again, look at recognition of prior learning. There's lots of links to further information on that. And we have really good RPL coordinators across ATU that can help you as well identify whether you may be eligible for that. So we have an online application form. Upload any relevant document. You often have to upload transcripts from past qualifications as well. Maybe gather that information together as well. The good news is you have time. We're open for applications up to the 15th of August 2025. So again, keep doing your research. Talk to our lovely academic colleagues here who are able to give you a real insight into what studying might look like. And again, your application, once it goes in, it's academically assessed, and then offers go out, and you won't be invited to register till mid-August. And we do have induction series as well then for people, especially our remote learners who maybe won't be coming on campus. You know, there is induction there for them as well, just to make sure that you can get settled in. Many people are coming back to education that maybe haven't been in education for a while. So we're there to support that as well. So just again, get your application in early, and that starts the conversation going around those areas. I've mentioned, and a lot of my colleagues have mentioned, recognition of prior learning. If you do go on to atu.ie/RPL, you'll find a number of video assets there that can talk to you about how you can use RPL for advanced entry, and how you can use RPL for entry as well. So it may be a case that you have studied to a certain point, you've worked for a number of years, and there may be learning outcomes there that can be taken into consideration. And again, our academic colleagues here are usually the people who can look at that and recommend you go down that route. So again, just plenty of information there on the website that might help you support that journey. Funding hasn't been mentioned maybe much, but I suppose a few people have mentioned it throughout as well. And I know, Daniel, you wanted to mention that there is some funding available. You might put something in the chat there around the hospice that offers funding as well for the palliative and end-of-life care. Obviously, the Centres for Nursing and Midwifery Education, they have funding available. Again, there's local contacts there depending on where you're actually interested in studying. Again, if you can go to the HSE website, you'll be familiar there with your local contacts. SkillNet was mentioned earlier. I think Breda mentioned that, maybe somebody who's in the private nursing home sector. There is funding available because obviously there is a skills shortage there. There's an encouragement and an incentive to upskill in the area of gerontology and gerontology nursing and gerontology practice. Springboard, I'll just mention it briefly as well. A number, I think the digital healthcare courses that maybe Carmel mentioned before, and eHealth, they have been previously funded under Springboard. Again, it's about skills shortages, where you will possibly get up to 90% of the fees funded through the Springboard initiative. That usually launches around May, June time. Currently on the ATU website, if you register your interest in Springboard, you will get a notification once we open and once we know what programs are approved for funding. So definitely, if you're interested in any of maybe those smaller certs as well, or postgraduate diplomas, they can sometimes be funded. Micro-credentials, again, there was modular learning mentioned there. Micro-credentials is another term for kind of small, short, bite-sized pieces of learning. There's some funding available now for some micro-credentials as well. 50 to 80% funding is available. Again, if you go onto the website there, you'll find some of those. And then SUSI funding as well can be available for full-time postgraduate study as well. And if you go to susi.ie, you'll find out more information on that. There is a fees and funding guide also available on the ATU website. Will help you navigate a few of these different areas where funding might be available. One to also mention, we're just running over time a little bit, so I know on this nice evening, I'm sure everybody wants to get back outside. We do have an alumni scholarship as well. So anybody, again, we heard there from our graduate that, you know, she was a GMIT graduate. Anybody who has graduated from our legacy institutions, LYIT, IT Sligo, GMIT or St. Angela's College, are eligible for an alumni scholarship, which is a 20% discount on taught postgraduate fees, taught master's fees. There's some information there around the closing date as well. If you've graduated with a level 8 from any of our legacy institutions or ATU itself, then you may be eligible for this, and there's a form online where you can fill in your details. So definitely that is a nice bonus, I think, for our alumni community. Finally, everything we talked about today, there is a part-time postgraduate, part-time prospectus available to download from the ATU website. We have it there as a QR code. Again, if you go to atu.ie/flexible, you'll find a download link there and all the details on the programs we talked about. We have some other events as well coming up. So if tonight didn't really meet with what you were looking for and you think you might need to go off and do a science course or a sports and nutritional science course, or in any of other areas there's a full schedule of webinars happening throughout the next month or two. And please do tell your friends and colleagues about it. If you know there's an area that they are interested in, you can register now. And again, we'll send you the information about it. And finally, I just want to say thank you to everybody. Thank you to my colleagues across ATU, Breda, Carmel, Patsy, Dympna, Daniel. Have I missed somebody? Apologies if I have. I'm just looking at the screen here. And thank you to everybody who contributed to the webinar this evening. The Q&A is still live. If there's questions gone in there and we haven't had a chance to answer them yet, we will continue to answer them throughout the evening. And again, we'll share contact details as well, and we'll share the slides so that everybody can follow up if they are interested. So thank you one and all, and I hope you got something from this evening and you have a lovely evening today.
Thanks, Cleo.
Thank you.
Thank you.